So this comes as the future for transgender care is up in the air, and President Donald Trump signing an executive order earlier this week to restrict gender-affirming care for people under 19. Not only that, Trump was also planning to freeze federal funding on loan grants and more aid. That's before two federal judges blocked that from happening. And if it passed, it would have ripple effects in many areas, including healthcare. So here to talk to us more about how this can impact the medical community and their patients is our medical expert, Dr. Payal Kohli. Dr. Kohli, thank you so much for being here today. A lot to discuss, and you're qualified to do so. You know, I'm seeing so many people on social media with opinions, including myself, and we're not the ones that know all the nit and grit. I mean, you are a Harvard graduate, medical student, and you've been practicing for how many years now? 2 decades almost. So I think it's really important to hear it from you. As a physician, what are your thoughts on Denver Health for suspending gender-affirming care under 19 years of age?
You know, Sam, it feels like the rug has been pulled out from under my feet as a physician, because the way that we practice medicine, science has been fundamentally changed at really every level, whether it's how we communicate the science, how we think about the science, how we fund the science. And this in particular really has me worried, because there are a lot of young transgender youth that are in the process of transitioning right now. And if you suddenly stop their hormones, we don't know what the medical implications of that are. We don't know what kind of harm it could cause their physical health, but also their mental health, as we just heard. And you're talking about not just doing it in the moment, you're talking about starting a trend where this type of research could potentially go away forever. Now, we know this is a disease, right? We know that having gender dysphoria, where you feel like you're out of body, it's a problem that people struggle with that needs treatment. So just to take it away suddenly because the politicians have decided that it's not something that's worth investing in, it really has me worried.
And what are some of the big changes under the Trump administration that physicians are discussing? I know how well connected you are in the medical community. Have you talked to fellow physicians within your inner circle, and what are you guys discussing?
Well, you know, I would say my email, my social media has been blowing up lately, and the thing that people are most worried about, many things, but it's really the NIH-funded research that I think has the most impact on the medical community, because if you think about it, it's been paused with everything that they're doing. So people have been waiting for a year or 2 years sometimes to present their research in front of committees, get it funded. That has been taken away. Now, we think this will create a ripple effect, not just today, but potentially for decades to come, because if we're researching cancer today, it changes how we deliver cancer care 5 to 10 years later. And if that goes away, that's a big deal. How we're communicating, like I said before, we're not getting memos from the CDC, we're not getting health advisories from the FDA, everything's been put on pause. So who do we turn to as physicians to know what's out there? How do I know somebody showing up with a new cough in my office has a new condition, or it's more of the same? All of this has us really concerned as physicians.
That is interesting, and I'm glad that you're talking about it. And talking about budget cuts in general, how does this impact? You talked about healthcare research today and then the long form of it, but what about your patients? Are you concerned about your patients right now? Will it affect them more today or more tomorrow?
You know, we've talked about research, but the clinical care of my patients is top of mind for me. And it's not just, you know, the new diseases they might be presenting with, but it's the access to care that these patients might not have anymore. Because we know that a lot of these, you know, Medicaid and others are federally funded partially. And the fact that federal funding has been cut really creates a ripple effect, especially on communities of color and some of our underserved patients who are hard enough to get into the office in the first place. And now you're saying, well, it might be more expensive for them to get health care. I think about, you know, undocumented immigrants who normally wouldn't even have maybe sought health care, particularly for communicable diseases that can spread to others. Now you've raised that bar even more. You're not going to have those types of people showing up in hospitals and doctors' offices because they're afraid that they may have some implications if they do come in the healthcare system. So I think there's so many things happening right now. I'm really hoping this is all temporary as the new administration settles in. But my fear is that what we've started here is a precedent where you've taken science away from the physicians, put it in the hands of the politicians, and we are left to pick up the pieces.
Dr. Kohli, wow, thank you for that. Appreciate you, as always.